What is intellectual disability?
Intellectual disability is a developmental condition. It's a condition that occurs either before birth, there's something that happens during birth or soon after birth during the developmental period. And usually it impacts two broad areas. So it's characterized by significant sub-average intellectual functioning, which are skills like abstract thinking, problem solving, understanding situations, learning, using what you learn in one context and applying it in another. Those are the broad elements of intellectual functioning. So that's one aspect. The other aspect of intellectual disability is also significant sub-average adaptive behavior. And adaptive behavior are the skills that we learn every day and perform every day to meet society's expectations. So these are skills that relate to social interactions, social skills, but also practical skills like independent living, self-care, employment. And then the third broad element are conceptual skills. So functional academics, using one's knowledge to um, interact with their environment, in terms of consumer skills, budgeting, but also communication and so forth. So intellectual disability encompasses these two broad areas, intellectual functioning and adaptive behavior. And if there are significant deficits that originate during the developmental period, that's what we define as intellectual disability.
What is it like to live with an intellectual disability?
I have some strengths and challenges like everybody else.
Too much change for me, either, especially when it's more like a huge change, I shut down very easily. And I can like maybe start crying or I get frustrated or irritated. So too much change for me is a problem. It's very difficult for me to deal with for our disability. I would say too, like transitioning from like being a child to an adulthood, and like realistically, knowing all those changes, because in life there's so many changes that happen. And with me being a young adult and being 22, it was a shocker with a lot of things that happen. Like so dealing with money, for example, I struggle with that. Budgeting was like an issue for me at first, but I'm learning how to do that properly. Like bills and rent and everything like that, and just like struggling like with everyday situations and things that come up. Has been struggles for me, and knowing how to adapt to them.
To live with an intellectual disability is having some differences in our level of skills in what we're good at and not good at. And some people judge us differently than others.
I like to read the sports page. Sometimes I ask mom and Matilda to spring dance. Do I mind have a disability? I'm happy.
What are some things people believe about intellectual disabilities that are not true?
That we can't learn and that we cannot communicate our own thoughts and needs.
Like I don't understand the questions. Like I don't understand what I'm talking about.
A person with an intellectual disability can't work. That is not true. Just because someone has an intellectual disability doesn't mean they aren't smart with like their finances or doing a job. They just have a different learning style.
What do you wish people knew about life with an intellectual disability?
With just some simple adjustments on how we are taught, we can learn.
Living with an intellectual disability has its ups and downs, but we try to get through it.
Why is it important for individuals with disabilities to tell doctors how they feel about their own health and well-being?
Patients themselves are always the best source of information about their own health and well-being. And it's no different for patients with disabilities. And it may be more important because often they're not asked or really actively included in their own health care. So for patients with disabilities, it's especially important for them to be able to ask questions and have the questions answered, to feel comfortable telling their doctor about how they're feeling, what they're concerned about, so that they have agency in their own health care, and so their providers can really promote their health and improve their well-being.
Why is it important for people with intellectual disabilities to speak for themselves about their health and well-being?
It's important for people with intellectual and developmental disabilities to speak for themselves because they are the ones who get impacted in how the doctor treats them, and they can't always rely on the caretaker or guardian to be there always because certain people come and go, and so they should try to learn to speak up to their level and even get better.
It's best for students or teachers to actually talk to the person that has the disability instead of, not saying that you can't talk to their parents though, but it's best to talk to the person that actually has it so you can get a better understanding of what it's like for them. Instead of, because your parents know though, but your parents don't, like, they're not actually living in your body, they're not actually living in your mind, so they don't know exactly what you have to go through every single day as far as challenges. So it's best to talk to the person that actually has a disability if you're trying to learn, like, research about it, like any type of disability.
Healthcare is one of those things where you have family wants what's for you and your doctor wants best for you, but again, they may not be communicating with you, and this is your body, this is your choice, what your body is telling you, and you should be able to tell, hey, I want this, and I know this is what I need. I don't need this, I don't need that, because I want to feel like I have the power in the situations, I have control in that situation, because sometimes doctors may not have a clear standing. Some doctors could we only hear them from the provider family's point of view, and that's what they believe. The reality is that's not what's happening.
Because nobody else knows how we're feeling but us. Just like every normal person, we feel just like every normal person.
Have you ever felt ignored by a doctor?
Sometimes, but not all the time. But I'm trying to make sure I answer the questions properly with the doctor, which is important.
How did that feel or impact your healthcare?
Yeah, I was kind of nervous, upset, something like that.
I've had a couple times. I think what it comes down to, doctors can't believe, when I tell them I have a disability, intellectual or developmental, they kind of look at me like, no, you don't. My disability is invisible, so it does perceive that, you don't need help. Well, the reality is I do. I just don't, I don't show it till it's too late, or I show it in different ways. I had doctors that flat out tell me, doctors and therapists flat out tell me, I can't help you know what to do with you. I had doctors that only listen to my mom or just listen to part of my story. I think a lot of it's not the doctor's fault per se. It's more educating them, because we don't know these mental or medical health personnel backgrounds. You may have some that didn't have any interaction until they became a doctor, or they have some knowledge but just don't comfortably how to help somebody. It did affect me a little bit, especially in the mental health field, as somebody who struggles with 2 different disorders and have severe trauma from my childhood. I should be able to be vulnerable and tell you about something very traumatic happened to me. But if I can't feel safe and trusted, I can't be vulnerable to tell you that.
No, I haven't. I know some friends of mine who have dealt with that though. They didn't really feel like they wanted to go back to that doctor. and then their health got worse over time, which wasn't good.
Why is it important for people with intellectual disabilities to be involved in research, both as research participants and as research team members?
Involving individuals with intellectual and developmental disabilities as co-researchers, partners, and participants strengthens all stages of the research process. From asking questions that are meaningful to the community, to finding answers in a way that respects the unique strengths and needs of study participants, to sharing findings that are clear, accessible, and useful. The insightful perspectives of individuals with lived disability experience can inform how to recruit and compensate participants, how to provide appropriate supports and accommodations for active engagement and full participation through self-report, and how to make sense of the data or interpret information learned through the project. A respectful partnership between researchers and community members from target populations under study is an essential step in building trust, engaging underrepresented and hard-to-reach populations, and spreading the study's key findings through relevant community networks. Combining the expertise of academic researchers with the expertise of individuals with lived experience holds the potential to make research more valid and ethical, and its results more reliable and impactful. In addition to improving the quality of research, studies have found that co-researchers with disabilities experience a sense of empowerment by being a role model and advocate for the community, a sense of pride and accomplishment in having their voice included in a professional setting, and a sense of belonging. Other direct benefits include expanded social and support networks and increased professional and practical skills. Inclusive research also supports the professional growth of academically trained researchers without lived disability experience by challenging previously held assumptions, promoting awareness, acceptance, and appreciation, and increasing expectations and positive attitudes about the capacity and competency of individuals with intellectual disability. Including community members with disabilities as co-researchers, partners, and participants is an important way to ensure that research reflects the diversity of human experiences. It respects the autonomy, dignity, and rights of individuals with disabilities and promotes the values of inclusion and equity. Giving all people opportunities to lead and guide research and speak for themselves is an important way to advance social justice. The Americans with Disabilities Act establishes everyone's right to fully participate in all aspects of society, and inclusive, community-engaged research provides valuable opportunities to fulfill this law.
Why is it important for people with intellectual disabilities to be a part of research?
What I like about research is because it's a good tool to use. Because you want to be part of it.
Knowing there is a project that we can be a part of that helps us and others learn about us.
So you can hear our voices. We tend to not be looked at or taken seriously in the research and healthcare world because they assume we don't know what some of the terms are, what the procedures are, or just have this misconception that we don't know what we're talking about. Or, the old analogy, should be seen, not heard mentality. And unfortunately, we're in the community living independent lives. Yes, we sometimes have to go to the doctor for whatever reason, and we want to be part of that so we can be heard. I love being heard. I love giving my input because, growing up, I couldn't give that input. I couldn't communicate. And now that I can, I could be that voice for somebody who may be in my shoes and knows, and I'm like, I know what it's like not able to communicate. I know what it's like not being taken seriously. But guess what? I am your advocate. I'm your voice, and I'll help you that researchers can have a better understanding.
I feel like I have to explain myself over and over and over and over again to people, and I feel like they just don't get it unless they experience it. So that's basically like a part of the reason why I'm part of this research group, because I do feel like I belong here, and I feel like there's others out there that are going through the similar thing as maybe not as much, but maybe like pretty similar.
Because they are the ones that have real life experience dealing with doctors, and they have a disability. The researchers don't have that experience because they are professionals. And so having people with intellectual and developmental disabilities sharing their stories becomes a very powerful thing and makes a big difference overall.